So you're getting ready for surgery or radiation for prostate cancer or recurrence of prostate cancer. Well, I want to tell you there's a number of things that you should know about what to eat, how to exercise, and how to prepare for these procedures. I've been through all of them very successfully, and I'm going to share them with you today. So grab a pen and paper, maybe a cup of coffee or tea, sit back, and let's do this.
This podcast deals with prostate cancer, surgery, medication, and other medical topics. The host is a prostate cancer survivor who is recounting his experience with treatment. He is not a medical professional, and you should not use his commentary as medical advice. Please always consult a medical professional when learning about and understanding prostate cancer or any other disease.
So as I'm recording this, I'm currently in the 6th week of about 8 weeks of radiation for recurrence of prostate cancer. And some of you have been following along my travels starting back in 2015 when I first was diagnosed with prostate cancer. And then I had surgery. And then about 8.5 years later, my PSA got to a point where we decided we were going to add some radiation to potentially thwart a recurrence. But in both procedure, both the surgery originally and the radiation that I'm having now, there were certain things that I did to help my body prepare for what was to come. And if it's any indication, these worked pretty well because as I am now way into my therapy for recurrence of prostate cancer with radiation, I really have almost no side effects. And I attribute some of these to the way I have taken care of my body. And that's why today what I've decided to do is put together a list of some of the things that you can do if you are about to start therapy. And this is going to come under two sections. I'm going to first talk about surgery, a prostatectomy, and some of the preparation for doing that. But I'm going to also talk about diet and exercise just as a good practice for any time you're going through any type of surgery. But what I found is I specifically prepared myself for these procedures and these therapies. And in doing that, I said, if I have a healthy body and healthy mind, then possibly I'll get through them easier than others may who have not prepared themselves. And, you know, we're all a little different. We're all wired differently. But if you can follow some of these tips, perhaps it'll help you as well. I want to also mention the sound quality. I'm recording this in a hotel room, not my usual studio. So I do have camera will travel, but I figured this is a good time to start introducing some of these programs for you. So let's get started. First things first, I want to talk about prostatectomy, and this is surgery to remove your prostate. Now, I'm not going to debate or litigate why have surgery versus radiation. I am a big proponent, of course, of surgery as the first course of treatment if you have non-aggressive prostate cancer. But anyway, what is about to happen in surgery is, as you probably know, your prostate is going to be removed. And then there's a space left over between your urethra and your bladder, and this is reattached, and then you're made whole, and then hopefully that's the end of your journey. But there is a problem in that there are side effects that men go through after surgery. The two most prominent side effects are erectile function and incontinence. So erectile function is when the nerves that control erectile function, the nerves that give you an erection, no longer function. And they may be severed. If you have more advanced cancer, they may be severed during the surgery, but in a lot of cases they're not. So you'll hear a lot of talk about nerve-sparing surgery. And if you're going to be having surgery, you should ask your surgeon, your doctor, about nerve sparing and what their techniques are. Every surgeon seems to have their own method, but if your surgeon intends to have nerve sparing surgery with you, then you want to have a healthy body to begin with so that your recovery is quite good. Same thing is true with continence. So when you urinate today, your prostate is one of the valves that controls urine flow, but it's not the only one. There is a sphincter, these pelvic floor muscles. There's a system in place that allow you to hold in your urine and only void it when you're ready to. So what I've found is, and I've spoken to a lot of men over the years, and I don't know if this is a pattern, but these are certainly things that I've noticed. Men that tend to prepare for surgery and take care of their bodies, both with diet and exercise and Kegels, which I'll talk about in a second, seem to have a better outcome after surgery. I can only speak for myself. I followed a very strict regimen, and I came out of surgery with very quick recovery of both erectile function, also continence. So I guess I can say it doesn't hurt to follow what I'm about to share with you, but I think also if you don't prepare yourself and you don't keep your body in shape and you don't do your Kegel exercises and you're not watching your eating habits, then, you're putting your body at a disadvantage because it's not going to be as strong for surgery. Some of this will apply to radiation therapy as well, but I'll talk about that separately. So I want to share, before I get started in some of my techniques, I want to show you that I sort of know what I'm talking about. So look at this picture. This is quite amazing. This is a before and after picture. And this is 6 months of a diet program that I've created for myself. It wasn't really based on anyone else's diet. I do call it an eating sort of diet, if that makes sense. But I'm going to share with you how I got from the first body to the second body in just 6 months. And it wasn't at all unenjoyable, and I didn't starve myself. As a matter of fact, I would eat, and I still eat 4 times a day. But I'm going to talk all about that technique as I get through these sessions. But leading up to surgery, you want to make sure, this is very important, your body's going to go through quite a bit of trauma. And we're very lucky because the surgical techniques of today, using robotic technology, which is hopefully the method you're able to take advantage of, the body is still very stressed. And if you look at the Da Vinci robot, there are a bunch of arms that penetrate your midsection. They move some of the organs around. They get in there with these little teeny scissors. They slice out the prostate. They stitch everything back together, and they sew you up. The surgery itself is not that big of a deal. I thought it would be a lot worse than it was. But in any case, the body kind of really goes into shock. I don't know if that's the right medical term, but your body has definitely detected something happening to it. So if you present a strong body at surgery, then I believe your recovery is going to be a lot easier. So let's address continence first. You have to be very, very sure that your pelvic floor muscles, your sphincter, are trained ahead of surgery, because once your prostate is removed, all the burden of keeping urine inside your bladder is going to fall on this one muscle. So you'll hear of Kegels a lot. And I can almost definitely say, I don't know if I'll say this 100% sure, but a lot of the men I've spoken to who have continence issues after surgery didn't do their Kegels, or didn't do them enough, or didn't do them ahead of time. Whereas a lot of men who have done Kegels very religiously and adamantly have had great outcome. Now, I'm not talking about all the cases, because there's always nuances with each of us, but there's a general consensus that if you do Kegels, you are really doing everything you can to make sure you come out of surgery quite well. So what's a Kegel? Well, it's a squeezing exercise, and it's kind of hard to describe, because how do you describe a feeling? But what I would say is, people have described it as it's a squeezing motion as if you're holding in gas. But what I like to say is, and men will appreciate this, and I know some of the wives and girlfriends are watching this as well, but if you have an erect penis and you're able to make it dance, and I think men know what I'm talking about, that's a Kegel. It's that squeeze. It's a little squeeze. If you're squeezing and you're making your penis dance, you're doing the proper exercise. So think of it that way, and then you'll know what a Kegel is. Now, the secret is to get yourself doing Kegels all day long, every day, starting at 30 days before surgery. And that's an arbitrary number, but it's a number that I use and seem to work well. And what you want to do is every hour, or even more if you can, but in the beginning, every hour, just try to do 10 Kegels or 20 Kegels if you can. So you're sitting and you do that little, there it is 1, there it is 2, there it is 3, squeeze. And you notice as I'm doing Kegels, I can speak, nobody notices. If I'm at a meeting, if I'm on a bus, if I'm talking to somebody, they don't know that I do this. So what I want you to do is do 10 of those every hour that you're awake of the day, starting right now. And as time goes on, try to do more. Try to do 20. And why wait for every hour? Maybe every 10 minutes, every 15 minutes. Every time you can think about it, just maybe do 10 or 20, just constant exercises. And this does an amazing thing to the body. It really strengthens that pelvic floor area. So at the time the prostate is removed, those muscles have really been worked out, and they really do a great job at holding in urine. And try it out. Let me know what you think. Now, there are some people who have failed to do their Kegels, and they find themselves with some issues after surgery with holding in urine. And the jury is out on whether Kegels after surgery will help you. In theory, they will. The problem is that whole surgical area is going to be very sore. And you want to remember, your urethra has been attached to the bladder. And I don't know if it's done with stitches or they fuse it. I'm not sure what the technique is. But that's a very sore area and a very tender area. And you don't want to overexert it. So if you're waiting till after surgery and then start Kegels, I believe they're possible, but they may be painful or uncomfortable. So why even go through all that? Do Kegels before surgery, starting at 30 days, at least 10 every hour. And if you really can't figure out what that Kegel feels like, just go back to that imagery that I sent to you. But it is sort of a squeezing of that inner area. And I guess you could say if you're kind of holding back gas, it would be that feeling. But think of the dancing penis, because that's what really does it well. Okay, so that's one part of it, sort of the exercises. When it comes to erectile function, that is something you can prepare a little less for because it is related to nerves. I do believe, I'm not a doctor, but maybe it's more of a hope than a belief system. But I think if you are treating your body well, that potentially the nerves also will be strong. I don't know if that's true or not, but it's something to kind of hope for. So we talked about Kegels. That's one thing you need to do before surgery. The next thing I want to talk about is physical fitness and training. And I would practice this for both surgery and radiation. The idea behind each is that you want to try to have your body in great shape by the time you go into either surgery or radiation. This will be a little more important for surgery than it is for radiation, but I think the idea with radiation is they're going to take a mold of your body, and then for roughly 8 weeks, they're going to radiate you Monday through Friday, and you kind of want your body to be in good shape and not changing weight over the time, so that one week you're heavier, the next week you're lighter. So both exercise and diet will come into this. But as far as exercise go, it's nothing that is entirely crazy over the top. What I would just recommend, and always talk to a doctor before exercising, because some of you may have heart conditions or blood pressure issues or other issues where exercise is not feasible. But assuming that you're in reasonably good shape, and I don't care if you're overweight or underweight, these are just things that you should be doing. So what I would do is I would plan 3 days a week. Try it Monday, Wednesday, Friday. And you want to get into a gym, whether it's a home gym, or I really recommend a gym that has a lot of equipment. And you want to work on weight-bearing exercises and not just cardio. So a lot of people think that a great way to work out, preparing their body for surgery or anything else, is just to get on the treadmill for 30 minutes, etc. The cardiovascular aspect of it is not what we're after here. What we are after is a very fit body where you have mobility, all right? Your body's moving around, you're tightening muscles, you're lowering fat. The diet will be part of that. So if you have the means to hire a trainer, I would highly recommend that. And remember, you're at a point in your life where you're fighting a disease that is there. Its sole purpose is to kill you. So we're fighting this disease to stay alive. And if we're going to do that, and if we have the means, let's get a trainer for Monday to Friday, or Monday, Wednesday, Friday, for all the weeks leading up to whether it's surgery or radiation. And I mentioned Kegels, you should start at 30 days. I would start training 60 days or 90 days before. Don't wait, start right away. And the type of exercises you're going to do will involve weights. So things like, you'll hear trainers talk about push-pull weights, but weights overhead, weights in front, bicep curls, squats, all these sorts of things. And there are different methods. Some people do legs one day, arms the other day. Some mix it up a little bit. But the most important thing is to get in a weight training program 3 days a week. If you want to do cardio on the odd days. Cardio is not necessarily cardio will be great for your heart, and to a certain extent will take off calories, but cardio is not exactly going to get your body fit for all the stuff that's about to happen to it. So that's why I want to see you having some type of weight training program. I wish I had the ability to offer you my program or what I did, but each one is different. But if you need help in finding maybe an online trainer, let me know. Send me a private message or a direct message, and I will try to see if I can find you what's called an online trainer. What an online trainer does is they'll give you an app. They will talk to you. You'll have some video consultations, and they'll create a program for you where you go to the gym with the app, and it will say, okay, for your first set, do 12 bench presses and try this weight, and and then you mark in the app, I did this. So they're not watching you live, but they're giving you the program. They're having some consultations maybe every couple of weeks where you talk about what you've done, and they work effectively well. So I have a personal trainer in person, but when I'm traveling, even here, I'm in Knoxville for treatment, my trainer has the same dialogue with me via the app. So I go to the gym, I do my routines, and I stay very much fit for that. This is absolutely essential. So find yourself a way to do that. If you need some guidance, like I said, let me know, and I'll try to at least point you to some resources. So if you're headed for surgery, you're going to do Kegel exercises starting at 30 days. You're going to do weight training 3 days a week minimum, starting at 60 or 90 days a week, 90 days before surgery. And the same is true if you're going to go through radiation, get yourself on a weight training program because you want to get yourself in good shape for the process. I will say radiation is not exactly, you don't really have a lot of side effects, at least I didn't. But the one thing about radiation, if you're about to go through it, is you're going to be on a testosterone blocking hormone for probably 2 months before you get radiation. And what's especially important about those of you going through radiation is this weight training, because as your body loses testosterone, it really starts to affect your muscle mass and bone density and certain things. So if you're doing weight training while you're on something like Lupron or Orgovix, it's going to help you tremendously. So any way you slice it, there are going to be benefits by weight training before either procedure. Okay? So we have that. Now, I want to talk about diet and eating. And this is so important. I would say diet is probably the most important thing you can do next to training, because even if you're overweight, if you adjust your diet to improve your overall health and your body's fitness, then your brain somehow takes it as a sign that you need to be a strong person. And in its own special way, your brain will find its own way of keeping you as healthy as possible. So what does that all mean? Well, if you're eating well and if you're training and you go through surgery or radiation, it's my belief, and it certainly is what happened to me, you will have the least amount of side effects and the greatest recovery. Okay, so I can't back that with any factual information, but it just kind of makes sense. And even if it isn't factual, your mind will be in a better place when you feel better about your body and you're eating well. Okay, so this is Mark's eating diet. That's what I'm calling it. And I can't say I really invented it, but I put it together just based on a lot of different methods that I've learned. So one thing that this diet is all about is it's based on low carbohydrates, high protein, high fats, and frequency of eating. So it's not the kind of diet where you're going to starve yourself. It is the kind of diet where you are going to eat meals 4 times a day, and they'll be good meals. The key here is that we're trying to, first and foremost, we want to eliminate all processed foods completely. So what does that mean? Anything that comes out of a box or out of a container at the supermarket, crackers, cookies, even, vegetables are another thing. But anyway, if it comes out of a box or it's, in a can, or has all kinds of ingredients on the label, you don't want it whatsoever. So that's rule number one. And this is actually a good practice for life in itself. So the way that it works is, you've heard of the keto diet, and the keto diet is one where you eliminate all carbohydrates, and you're eating basically meat and cheese and fat and all that kind of stuff. So that's part of this. The beauty is we're not eliminating carbs. So you will try to stay away from simple sugars and carbs that give you insulin spikes. And I'll talk about that in a sec. But you can blend things together, and each of us are different. So part of the fun in this diet is combining foods and seeing if it creates an insulin spike. And let me just dig into that and unpeel that a little bit. So what makes you fat? And what makes us heavy? What makes us thin? So your body has two methods of fueling itself. It has sugar and it has fat. When you consume sugar, your body will use that for energy. And when there's no more sugar left, it will go to the stored fat in your body and use that for energy. But what the body also does is, in its everyday way of being, your body will take food that you eat and will have to make a decision. What do I do with this food? Do I use it? Do I store it as energy for the future? Or do I just kind of pull what I need from it and get rid of it? So this is the conversation the body has with itself every time food is being consumed. When the body digests food, which it determines is a good energy source, depending on the type of energy source, it may direct the body to store it. So as an example, if you are going to eat a cookie, right? Your body sees all the sugar and it says, this is assuming you're sitting watching TV eating a cookie. So your body doesn't need all that cookie at this moment. And it says, well, I have all this energy. I'm not going to waste this. So let me then store this so I can use it at some point in the future. And what it does is it sends a message to the body to create insulin. And when the body creates insulin, it's a message to the cells to take this energy and store it as fat. Okay, so how do we get fat? How do we get overweight? Well, we eat food that our body determines to be high in sugar, high in calories, and we then instruct the body through insulin to store it. Okay, so the way that we fight this and the way that we try to have the body not store everything we eat as fat is in a couple of ways. First and foremost, we try to eat foods that the body won't immediately interpret as being really, really high in sugar and really good to be stored. So the kinds of foods that we eat. So you hear this all the time, not processed foods, as I mentioned. So for example, we do need sugar. We need glucose in our body. And so, you get that from different things, from fruits and from vegetables and different things. But if it's just eating a cookie, those are carbs that are they're not really good for you. They taste delicious, but they just kind of get stored. But the secret to this diet is to figure out, what can I eat? What kind of foods can I eat so that when my body digests it and brings it in, when it kind of makes that decision, do I store this as fat or do I use it? Do I use it for energy now and expel the rest? That's the secret. The secret is glycemia, a glycemic index, and how your body interprets that. But that's the secret. So what this diet is all about, and I'm being very long-winded here, this diet is about what can I eat, what combination of foods can I eat, especially with carbohydrates, where the body doesn't decide that it needs to store it and it uses it at that point. So we have a tool that helps us figure this out. And you've heard of something called a continuous glucose monitor. And you can see right there, I wear one. And what this does, this gives you a reading in real time of the food that you eat. Once it's digested, let's say an hour after you eat something, this body will tell you if it had to produce insulin as a result of eating this food. So what this helps you do, this helps you look at combinations of foods and helps you determine if this is something which will keep you from putting on weight or even losing weight for that matter. So you apply the monitor, and by the way, applying the monitor It's no big deal. Watch this. So what's great about the Freestyle Libre 3, it's really, really easy to apply. So this is what comes in the box, and you twist it open. And then inside is the applicator. Well, this is the applicator. The device is inside. And then all that you do is you come up under your arm. Look at this. And that's it. So I have to change this every 2 weeks. It's painless. I promise you it's painless. But what happens then is on your phone from the glucose monitor, and what you'll notice is you have this line which is fairly consistent across the graph. And this is measuring blood glucose levels. It's actually measuring insulin, but just to make it simple, we call this sort of a measure of glucose. So if you can eat throughout the day and keep this line somewhat consistent, then you're doing a great thing for your body. And what this means is your body will be using stored fat for energy rather than this food that you just ate. And then the food that you just ate, because this will be lower in sugar, the nutrients will be pulled from it, certain energy will be pulled from it, and the rest will just be expelled as waste. So this is the idea. If you can go through 7 days a week eating foods and keeping this graph somewhat consistent, then you're going to lose weight and you're going to feel the best you've ever felt. So that's what got me from this to this. All right. So this is 6 months of me just following this routine. Now, let's say you don't eat well. Let's say you hit Panda Express, which for me is the biggest spike, or you eat cookies or cakes, then your graph will look more like this. I mean, look at that. So all these ups and downs, these all represent times where your body triggered an insulin spike. And so the body then took all the food that it was digesting and looked for any type of sugar or glucose source, and it went right into the cells to be stored as fat. So if you're eating 7 days a week and you see this type of zigzag, then you're putting on weight. It's as simple as that. So that becomes the question then, how do you control that? Well, you control that with eating. So as an example, I can eat an apple and I might get some spikes because the apple does have sugar in it, even though an apple is good to eat because it's natural sugar. It's not a processed food. But if I were to have an apple with peanut butter, then the spike may be minimal or not at all. And what happens is, fats and proteins tend to counter the effect of sugar in certain foods. And that's the magic of this whole diet, is you can combine carbs and proteins and fats and vegetables and lose weight. So an example you can have, at least I can have, because we're all going to be different. Our spikes are going to be different. I can go to a barbecue place and I can have coleslaw, I can have beans, I can drizzle olive oil and put cheese, and I'm just fine. That will be a meal for me and it will work just well. My breakfast almost every morning, it consists of 2 or 3 eggs with cheese, with olive oil, salt and pepper, and I take an avocado, a full avocado, and that's my breakfast. It's very satisfying, it's very filling, and I lose weight. And I'm very, very happy to eat those foods. So the whole diet becomes a question of what can I put together, what can I eat that doesn't create an insulin spike. So you'll have to get one of these, and you need a prescription to get one. The one that I use is called the Abbott Freestyle Libre 3, and I pay $75 a month. And that includes 2 units, because every 14 days you're changing around. You'll need a prescription, but your insurance probably will not cover it unless you have diabetes. But if your doctor will give you a prescription, the pharmacy will fill it, and they should be able to apply a discount code through something like GoodRx that gets you this for about $75 for the month. But the idea then is to eat what you like, check the graph. If it's spiking up and down, don't eat that. Change it to something else, and then start experimenting with different meals. The great thing about this diet is after about the first month, maybe 2 months, let's call it 2 months, if it's working well for you, you can have cheat days. So if you take a Saturday or Sunday and go with pizza and Burger King and all this kind of stuff, you'll get a bunch of those spikes. but by the next day, you'll be back to normal, and it's not really going to affect the body. So that's a great thing. You can have cheat meals from time to time, but it's very important to kind of adapt this type of a diet and a program. There's another part to it as well. The order that you eat food is absolutely key. So what we want to do is we want to eat food in 3 orders. The first thing, let's say you have a plate and you have a steak, you have a salad, you have a baked potato with cheese on it. Maybe a baked potato is not the best thing to have just yet, but let's say you have some type of carbohydrate. Let's call it beans, black beans. So what you want to do is in order, this is very, very key. You first want to eat your fiber. So anything that's fibrous, whether it's lettuce or broccoli or vegetables, avocado, and I guess in this example, I would put beans in this category. Beans are both a fiber and a carbohydrate, but the idea is eat the fiber first. Then, once you've eaten all of that, so if you're the type of eater that goes around the plate, try to avoid that on this diet. Eat all your fiber first, then eat your proteins, okay? So eat the meats, the chicken, eggs, whatever you're eating, eat the protein as number 2. Number 3, which you can sort of combine with number 2, but fat and oil, you want to be number 3. So a lot of times 2 and 3 fall together because I'll take, let's say, a burger without a bun, and I'll put cheese on the top and olive oil. So that's kind of the protein and the oil all at once. But the idea is to try to, if you can, separate it, protein first, then oil, or have it all together. So at this point, let's say you have a salad with chicken and cheese and oil and all that stuff. Try to pick through the salad to eat the fibrous stuff first, and then eat the cheese, and then eat the proteins. And last but not least is you want to eat the carbohydrates. So if you're having beans, even bread, yes, you can have bread on this diet. Let's say you want to have a full meal and a slice of bread, save it to the end. Have the bread last. This is very, very important. Now you can butter the bread and you can put cheese on the bread as long as you have that last. And what you're going to find is the fiber and the protein and the oils, they will impair the body's ability to produce insulin. So what that means is if you have carbohydrates, they're coming into the body, and the insulin may want to spike up and store it, but it's being put off by what you ate before. So eating those things first will negate the carbohydrates. Not completely, but once again, it comes down to looking at that graph in your glucose monitor to kind of see what its effect is. So that's the secret of it all. I've really gone on a long time talking about this, but it's up to you to really figure out on your own what those combination of foods look like. Another thing that's really important is if you're eating a meal and you've had carbohydrates, and let's say you've spiked a little bit on your graph, then go for a walk after that meal. Go walk for 30 minutes, whether it's around the block. If you have a treadmill at home, just get on the treadmill. It doesn't have to be overly exerting, activity. Just get on there for a nice walk. That will actually lower the spike and will impair, to a certain extent, the body, the ability of the insulin to affect the amount of sugar that gets stored as fat. So let me summarize this briefly. If you're going for treatment for prostate cancer or recurrence of prostate cancer, then you want to exercise prior to the procedure, starting at 60 days, and you want to focus on weight-bearing exercises. Anything with weights in the gym, 3 days a week for an hour, and if you can get a trainer, that will be absolutely fantastic. If you can't get a trainer, get an online trainer who is someone that will give you a program and will watch from a distance, not in real time, but through an app, and they'll prescribe what you should be doing at the gym every day. If you are going to be having surgery, a prostatectomy, then what you want to do is start your Kegels 30 days before surgery. Every hour of every day, do at least 10, and just a little squeeze, a little squeeze, little squeeze. That is going to make so much difference. And then diet, eating. Get yourself, it's always in the wrong, get yourself a continuous glucose monitor and watch the graphs. So eat 4 meals a day, breakfast, lunch, dinner, and a snack that are a combination of fiber, proteins, fats and oils, and carbs if you like. The great thing with this kind of a diet is you can have a lot of cheese and a lot of oil. And watch that graph. If you can keep the graph somewhat consistent across, your body will lose weight. The workouts that you're doing will help you get toned, and you'll be in amazing shape. And even without having procedures ahead of us, just following this diet is just a great way to bring your body down to a reasonable level. And it doesn't matter how old you are. I'm 60 years old, and I did this diet last year, and I think I dropped about 30 pounds. It's just amazing. And it's very easy to do. So I hope I didn't forget anything. I know some of you that follow in YouTube and on Facebook had some specific questions, but if you do, just go ahead and leave me comments. I'll try to answer as much as I can. But I hope this has been helpful to you. It's been a very long episode today, but I think it's important to understand what some of these things are. As I said, these all worked for me tremendously. And I think the reason I had very few side effects after surgery and during radiation, as I'm going through right now, is because I've prepared myself properly. So I wish all of you well. Keep tuning in. I've got all types of great content coming up in the weeks ahead. And as always, it's always my pleasure to help you in any way that I can. So please take care of yourself, and we'll talk very soon.